Hello, this is Dr. Betty Rubinowitz, NextGen Chief Medical Officer and Principal with NextGen Advisors. Welcome to our podcast. I'm joined today by our fellow NextGen Advisor, Chris Emper. Chris, of course, is also Government Affairs Advisor at NextGen Healthcare. Welcome, Chris.
Thank you, Betty. Great to be here.
In today's podcast, we're going to discuss the new $1.9 trillion COVID-19 aid bill that was just passed by Congress and signed into law by President Biden. I'm particularly excited to have this conversation with you today, Chris, because you have a unique ability to simplify, summarize, and analyze even the most complicated pieces of legislation. And this COVID-19 aid bill is certainly large, broad, and very complex. My first question to you is kind of a general one. In your experience, among probably hundreds of bills that you've reviewed and analyzed, where does this bill stand in terms of its breadth, complexity, and potential impact?
Great question, Dr. Betty. Off the bat, you look at the price tag of the bill, and at $1.9 trillion, it's quite a large bill and larger than most we deal with outside of the annual federal budget. To put this in context, compared to world economies, this bill alone would be the 8th or 9th largest economy of the world on its own. Right behind Italy, about the same size as Brazil and even Canada. That's how much money is allocated in this bill towards COVID relief activities.
Wow.
Beyond the size, it's 618 pages in length, so a lot of different provisions. And of course, as with every bill, that 618 pages in legislative text will then trickle down through the regulatory agencies and bodies, and they will write thousands of pages of additional legislation to actually authorize the provisions in this bill. So there's multiple levels of complexity at play there. And then when you think about the potential impact, especially within the healthcare world, off the bat, there are a lot of provisions in this bill which are not necessarily directly healthcare focused. You have about $500 billion for unemployment insurance benefits tied to the pandemic, $400 billion in the stimulus checks, $350 billion for state and local governments, and $130 billion for K through 12 schools. In terms of healthcare specific provisions, everything from vaccines to testing to all of the different provisions for healthcare providers and insurance coverage, you're looking at a number of approximately about $150 billion. So overall, you're looking at a little bit less than 10% of the bill allocated directly towards healthcare provisions. And I think those type of top-line statistics are always helpful when sizing up 600-plus pages and $2 trillion when you're trying to figure out what the benefit and impact of the healthcare industry will be.
Absolutely. It's quite staggering to think about it in those terms when you compare it to these international large country economies. It's also interesting that healthcare now represents almost 20% of GDP, yet its representation in this specific bill is about half that, and that's an interesting observation in itself. Was there anything in the bill that surprised you?
Several things. I think, first of all, it's notable that this is the first major legislative accomplishment of President Biden's term and from the new Democratic Congress. And of course, that's not surprising in and of itself, but if you trace back, a few months and think about how exactly this happened, and it's distinguishable from the COVID aid bills that passed last year where we had, of course, a different president, but also a split Congress with Republicans in charge of the Senate, Democrats in charge of the House. It was unclear how it would happen in the new Congress with the new president aligned under, Democratic Party leadership. And ultimately, the bill was passed on a party line vote with only Democratic support, not without Republican support, which certainly reflects some of the provisions in the bill. But I think, one thing particularly that surprised me about several of the aspects of this bill is that there is just such a large dollar figure attached to some of these provisions, and the budget window of when this money can be spent goes out beyond just 1 year. Mm-hmm. So they score the bill with $1.9 trillion over 10 years, and some of these provisions will be extending years out into the future. Others are just allocated for 1 or 2 years, and then absent reauthorization would sort of fall off. So there's a couple interesting dynamics playing out there. And I think always when you look at a bill and exactly what is permanent, what is temporary, there are necessarily some surprises in there just based on the math they need to put together to get a bill passed into law and the political compromises that need to be made to get votes from every member of a particular caucus.
Let's narrow our focus now to a few healthcare specifics of the bill. The bill has provisions in support of federally qualified health centers, behavioral health, and Indian health clinics, as well as rural healthcare providers. Chris, what are some of the key elements of these provisions?
Excellent question, and I think most notably is what's not included in those provisions, which is no additional money for the overall HHS Provider Relief Fund, which is how they decided to allocate most of the funding for hospitals, physicians, and healthcare providers throughout the COVID relief bills last year. There's actually $178 billion tied to that funding that was, rolled out through various different programs, but basically allocated across the country in the early days of COVID to different healthcare providers to make up for both lost revenues and increased expenses as a result of COVID. There's actually still about $20 billion left in that fund. So in this effort, they went with more targeted relief at some of these safety net providers, or so-called safety net providers, as you just mentioned. Specifically, we have $8.5 billion for rural health care providers, $7.6 billion in supplemental grant funding for community health centers, or FQHCs, $3.5 billion in supplemental grant funding for behavioral health programs, and then overall about $6 billion in funding for the Indian Health Service, which is allocated in different areas. From my perspective, the community health center funding is probably the most notable because you're looking at an additional $7.6 billion in funding on top of their normal allocation in a year, which is about the same amount, about $8 billion. So it basically doubles community health centers' contributions from the federal government in a year. And just to put some scale behind this, the CARES Act, the $2 trillion act that passed into law a year ago, had $1.32 billion in supplemental funding for FQHCs. Here we're moving that number up to $7.6 billion. Wow. So it's really a historic investment in community health centers and from a factual standpoint, the largest since the Affordable Care Act was passed in 2010 in terms of the federal government's spending on community health centers in a given year.
So clearly that magnitude of support is going to have a very significant impact on these health organizations. Can you, looking back at the last year, what in your mind provided the impetus or the justification for this that allowed this very large amount to be allocated?
So I think looking back at the early days of the pandemic, the philosophy behind the CARES Act, which was an entirely bipartisan $2.2 trillion effort that I think every member in Congress voted for, was let's just get as much money out the door as quickly as possible to help, all sorts of business sectors, but specifically in healthcare, just to make sure that, physicians and hospitals and community health centers wouldn't be going out of business. Since then, they've evolved the approach, and then specifically here, they're looking to make these more targeted investments in the safety net providers. And I think, kind of backing that out and tracing that back up to a political perspective of how it ties into the broader agenda from the Biden administration, one of their major focuses is on reducing inequities. And they view this in terms of healthcare, these safety net providers, as the primary avenue towards, investing in the communities and the different initiatives targeting, inequities that they're focused on. One notable thing, though, is that President Biden has said that his philosophy here with these stimulus programs and with this aid is to get the money out the door as quickly as possible and not worry about, allocating too much. And when you think about this money that might go to federally qualified community health centers, the CARES Act $1.32 billion you still have about 25% of the funds in that program that haven't been allocated. And the way these grants are rolled out, HHS always has some form of cost-based or resource-based justification that needs to be made for the fund. It's not sort of a blank check all the way back to the hospital-based reimbursement system for Medicare. So it's possible that all this full $7.6 billion will not be allocated. But I think the philosophy was, let's make sure that HRSA has the money and HHS and the governing authorities to provide it if these providers need it, not only to provide for the pandemic, but to move the ball on some of these broader healthcare policy goals of the Biden administration.
Mm-hmm. From your experience, Chris, how long would it take for a federally qualified leadership team to start paying attention to this and begin the process of applying for these or planning for these? Is there months till then, or do you think this will happen from your experience much more quickly?
I think within a few weeks to certainly a month, we'll have some notice from HRSA, the department of HHS who runs the FQHC grant programs, about what the grants will look like, and a little more information on the application process. Then they usually have a month or two for the application, an approval process. And then ultimately later this year, we'll probably start to see those dollars allocated. But I certainly think for any organization, you know that the money is in the law. The next step is waiting to see how the money will be allocated and what the grant program looks like from there.
So if federally qualified or Indian health or rural health groups, what would you recommend that they do right now? It's kind of a wait and see for the next few weeks. How would you prepare?
I think going through HRSA and their program and their application process. I think FQHCs in general, because they receive what's called Section 330, the grant program for community health centers where they receive their federal support. That's an annual process and sort of a mandatory process for FQHCs. This money comes in supplemental funding, so it's slightly different than that. But I think through the normal, formats they usually go through. But certainly for anyone who's sitting in a managerial position or an executive position at a community health center, you see a press release or a news release come out from an industry source that says, historic investment in community health centers, $8 billion. I think that's certainly something that they're going to be picking up the phone and, asking their team and their representatives at HRSA and their contacts about exactly when and how and the characteristics of where this money is going to come out and when.
Yeah. From your review, are there any types of investments that will not be supported through these monies? Technology acquisition and things like that. What's your analysis on that?
Ultimately remains to be seen. Specifically for the community health center money, the Act says it's to quote, or the money will be provided to quote, establish, expand, or sustain the healthcare workforce, or to quote, modify, enhance, or expand healthcare services and infrastructure, end quote. So now the processes of the lawyers and regulators at HHS defining exactly what that means. But from that rather broad justification under Congress, sometimes they're much more specific in terms of what these funds can be used for. I think it's possible that all the items you just mentioned could be covered by this money.
That's very helpful. The Affordable Care Act that was pretty beleaguered over the last 4 years in the previous administration seems to have enjoyed some attention in this bill as well. What are some of the central aspects of the focus on the ACA in the bill?
Yeah, so the two major, there are really three buckets of healthcare provisions in this bill. One are the COVID-focused provisions. We talked about vaccines, money for testing, et cetera. The second, provider relief funding, which we kind of just did a rundown of. And then the third is an expansion of insurance coverage. And really three main categories there. The first, a subsidy program for COBRA, continuation of work coverage through September, something that usually doesn't happen but is tied to the pandemic. The second, some incentives for Medicaid, and specifically for expanding Medicaid for the 12 states that did not choose to under the Affordable Care Act. And then the third, some really historic, biggest since the Affordable Care Act passed in 2010, expansion of subsidies, the tax credits and cost-sharing subsidies tied to the individual market exchanges in the ACA. And really this, 10 years later, 11 years later, amounts to the biggest expansion of these programs under the Affordable Care Act since the law's passing. Specifically, in terms of the individual insurance market, there is a rather generous expansion of the premium tax credit subsidies in the law, and also a institution of a cap where an individual would only spend 8.5% of their income on these subsidies. And just to put this in context, the ultimate impact here, 1 year to the next, 64-year-old with $58,000 in income currently might pay about $13,000 in premiums for an exchange plan in the Affordable Care Act. Pretty expensive with no subsidy. Under these changes, that individual would have a $8,000 subsidy, so their payments would be reduced to $5,000. So pretty significant, depending on exactly where you are in that income scale and within the program. So, again, some very significant investments in these programs. And as a result of that, the Congressional Budget Office has projected that 1.3 million people who don't have insurance today would be covered by the end of next year as a result of these provisions. One last thing I'll mention on that, though, that from a political perspective will make it interesting, these ACA provisions were only instituted for 2 years, 2021 and 22. So they will expire absent a reauthorization in 2022. And as has happened with other federal programs, it'll be interesting to see whether they're reauthorized, and based on the impact to individuals in the insurance markets, whether politically speaking that will be something that will be very difficult to do, which I think largely has been the stated intention behind some of the policies, to kind of roll them out temporarily and then see if they can make them permanent, depending on how it goes.
Yeah, and that will interestingly completely coincide with the midterm elections, and this will likely become an election topic and decision. So this has been great, Chris. Our time is up today, but I'm sure we'll be revisiting this bill as it's implemented, and we'll have you back to help us understand how it evolves and develops over time. I'd like to thank you, Chris, as you always do, for distilling the essence of the law and sharing it with us in such an understandable and helpful way. Thank you as well to our listeners for joining us today. If you enjoyed today's discussion, consider subscribing to our podcast. This is Dr. Betty Rabinowitz with NextGen Healthcare. Have a great day.